Good evening, everyone. Good evening, everyone. Welcome back to our second session on Women and Child Health webinar series by IHMA National Women's Wing. It gives me great pleasure to once again introduce our respected faculty, Dr. Rekha Karnam Srinivasan, a renowned homeopathic expert with more than 2 decades of rich clinical experience. She is a seasoned orator and writer with over 30 published articles, a medical blogger, teacher, mentor for workshops on cancer care and autism spectrum disorders as part of Iconic Women Homeopaths. Currently, she is the editor in chief of the upcoming book Essentials in Case Approach and Management of ASD with Homeopathy. In the previous session of Role of Homeopath in Autism Spectrum Disorders, we had the opportunity to gain valuable insights into autism spectrum disorders. Today, she will continue to the topic. With her vast experience and passion for teaching, I am sure today's session will be equally enriching and engaging. Let us welcome Dr. Rekha Srinivasan and look forward to another informative class. Over to you, ma'am.
Good evening. Good evening, doctor. Thank you, doctor, for the very wonderful introduction. Yeah. Today I want to talk about continued part of this seminar series. And thank you for the overwhelming response for all the views and all the response for the. Hope I am audible. Yeah,
Yes, ma'am.
I'm audible. Yes, yes.
Yes, ma'am.
Yeah, I am very thankful for one and all for the views, for the interest generated by my first webinar, and then also I'm very happy to know that many people have voted in my that poll also, and it's very heartening to look at that as well. So today we will have some discussions over those points. And the second in the series, today I'm going to focus on teens, already diagnosed cases, teens and adults, ASD management. And hopefully it will be helpful in your clinic as well as detecting and helping your patients with autism spectrum disorder, not only that, in general. So hope it will be very helpful. With this note, I will start. The role of a homeopath in treating ASD in diagnosed cases in teens and adult ASD. So we have a small, it's a just a brush up. Though you all know about this, I want to give a small brush up so that it will be helpful to know what I am speaking about. So, as you know, autism spectrum is the most sensitive problem in the society. It is identified when the child is 3 year old usually, and there are multiple symptoms such as difficulties to communicate with others, so understanding of others' talk, low ability to of studying, playing, smiling, and loneliness also. And social interaction is hard for these children. And then there are various types of ASD, autism disorder, that includes Asperger's syndrome, pervasive developmental disorder, not otherwise specified. Hope you remember I had shared a case about PDD-NOS in my previous lecture. So, their autistic disorder per se, Rett syndrome, childhood disintegrative disorder. And then Asperger's syndrome, this is diagnosed between the age of 5 and 9. It is very mild in symptoms, so it is usually missed diagnosis. And PDD-NOS is a problem is sequence of disorder that takes in delays in development such as social interaction, communication, walking, talking, and lack of ability to use their imagination. So I had, as I told you, I had shared the case where the boy started noticing things. He started having meaningful interactions. He can understand the social cues. He he is in normal school even now. He had little difficulties in his comprehension and mathematics, and again he was treated with homeopathy, and I think he is doing great now because actually I insist them that you should not call him an autistic boy. He is no more autistic. He is a normal child with little differences, and sometimes that is not easily uh, carried over. Most of the patients, parents, and the people around them, no, they'll be stuck up in the old things, and they will be behaving in this just the old way, and it is very detrimental to the patient. So, and autistic disorder per se, this type is also having the difficulty with communication, and these children show actions to express their thoughts. Then it will continue when they grow up. Their intelligence level is either below average or above average, which is called as high functioning. The symptoms are as lack of eye contact, lack of modulation in their speech. I want to share a case. It's a very long case. The girl of 5 years old, she came to me. She was referred to me, and um, she was non-verbal. She had no eye contact. She will not even pinpoint to show I want this and that. Mother has to understand herself what she really needs. Like she will come to the kitchen, then she has to understand, oh, okay, this girl needs food in that way. And she was treated by a homeopath, another homeopath. But parents thought it is not helping much. For 1 year, she was treated, and then she came to me, and I treated with, and also she had uh, no other symptoms. She's a very, very mild and very calm and a cute child. She will sit and she will not do any problem as whatsoever. She's a very mild child and very, very adjustable. And then I started with pulsatilla, and then carcinosinum helped her a lot. And then she had some features of phosphorus afterwards because she was very loving and caring, and she was always smiling and during the course of treatment. And then I gave her phosphorus also single dose. After that, she developed a high fever. That was around 1 or 2 fever. And the rest of the story I will tell you later because it's a very long case, and I hope it will be very interesting as well. So these type of cases where uh, they have no uh, communication, only they can show the things. And she came to that level. She can show she wants this or that. She will pull her mother's hand and she will take to the place. She asked for that. So she improved to that level. Also, her eye contact improved. She didn't become verbal, but her interactions with other kids also improved. And but still, it's a very long story. I will tell you second half afterwards. So there is a lot of improvement in that case. And then Rett syndrome. This also I shared one case in previous uh, lecture. This type of autism especially occurred in girls and shows 6 months to end of their life. The symptoms such as breathing problems, sleep problems, teeth grinding, slowness of growth, different way of walking, and slowly they lose their abilities in each level of their age. Finally, at age of 10 and above, the physical decline may be very severe. As I told, in the case of the child, she is maintaining it at the same level. She didn't decline further. And childhood disintegrative disorder. Most of the children have normal development till 2 years. Then they slowly lose their abilities, but it happens for only few months. The behavior such as anxiety, no bladder control also occurs. The symptoms of this disorder, children are doing some activities repeatedly and move away from one activity to another is very hard. So these are all actually you can see that they are all overlapping each other. So it is not that purely these are all compartmentalized. They are all overlapped with each other. So how to go about these cases? See, if we compartmentalize it into severely into this symptomatology or whatever we do, practicality is more important and how we have to go about them. So I find practically it's more important to know the uh, severity of the condition. So phenotypes and these genetic based researchers are not practically helpful in our clinics, right? And it is very difficult to categorize them. They are more important for researchers. So it can be done effectively by grading the severity. How? ASD level 1 requiring support, 2 requiring substantial support, and requiring level 3 where they are have to be totally on support. And this and ASD level 1 that are milder cases, they can be difficulty maintaining eye contact, reading body language and social cues, initiating conversation, problems making friends, troubles with responding as others would expect, difficulties maintaining interest in conversations, trouble with organization and planning, feeling uncomfortable with change, such as new environment. So they need support. And then moderate level, they have little more severe problem. They can't speak in full conversation and speaking infrequently, staccato speech, right? And repeating words have been said in that way. And their topics are very restricted and they will talk only few things again and again. Whichever they are interested, they will be talking only about that. They don't understand that people are bored and they don't take interest in what they are talking about. And so non-verbally, they can't express themselves and difficulty in non-verbal communication as well. And distress when change interrupts their daily routine. Uh, I had one child who is having uh, near normal development, but she was a very what to say, restless child. So much so that it was a very big task. One whole uh, team should be there to control her. It was such a big task to control her. By 3 years, she had mm, and she received many medicines, but she didn't improve much. She was very restless and running around, and it seemed to be a normal thing for the child. But once, when she was about to go to some other place out of her house, she cried for almost 3 hours non-stop. And that point was like we could understand that the child has so much of difficulty going out of the routine. And then she received Lycopodium 200. That was her remedy for a long time. And she improved a lot. This case also, I will talk about that later. See, only at certain point of time we will understand, we can differentiate between what is seems to be normal and what is there is some problem, there is some issue, and they have to be uh, treated, isn't it? So, and in severe level, as we already spoken about them, little to no verbal communication, only communicating via gestures and pictures, engaging in self-injurious behavior, aggressive outbursts, limited interaction with others, So this self-injurious behavior is very, very important thing because most of them in the severe level cases, they have that problem. And limited interaction, no interest in friendship, repetitive behavior, extreme difficulty dealing with changes in daily routine, high levels of distress in situations that require them to change focus, difficulty with daily living activities like taking care of the hygiene. So they are always on the utmost support. They are in need of utmost support. And then, so clinically, mild cases can be efficiently treated, moderate can become mild or normal, and severe cases do not improve much, symptoms can be moderate. But severe cases, they have most probably have some genetic origin. There will be have something background in genetic bag. And so this we have to pay attention. So why we are talking about genetics, I will clarify. It may seem as a homeopath, why we need all these things, right? We are taking the case, we are going by the symptoms, we are helping them. There are so many homeopaths, they are already treating so many cases with single remedies, single doses, or they are treating with so many other uh, whatever is needed for them, like occupation therapy and other things, whatever. But my point is, as I told in the first webinar itself, it should be a holistic view about the case. It is like, it should not be like we are treating a elephant whom we know six blind men and they are touching the elephant. It should not be like that. So knowledge is always a power. And if you have to treat a case which is of a elephant-like thing, at least we should know the outline of the elephant. And then we can get the help of others and we can give the optimal benefit to the patient and the their parents. So psychiatric disorders often overlap and can make diagnosis difficult. So depression and anxiety can coexist and share symptoms with schizophrenia, anorexia nervosa, autism with ADHD, and there are 8 psychiatric disorders which share the same genetic cause. So these three groups of highly genetically related or they have the similar genomic relationships, novel loci, pleiotropic mechanisms, and they are anorexia nervosa, ASD, ADHD, bipolar, major depression, and schizo. And then this aligns with other findings which has a genetic risk factors across various disorders. So these findings revealed overlapping genetic roots and even linked groups of disorders and neurodevelopmental conditions and highlighted how many of these genes are active during brain development, isn't it? So I have some points. I will clarify it. You may think it is too much for us. It is only for researchers, but please be with me. You will understand. And these are all the mutations and uh, deletions. So, and there is genetic conditions like macrocephaly and tuberous sclerosis. We had spoken about these genetic conditions previous. So the point is when there is some genetic condition underlying, whether it is deletions of the nucleic in SNPs or additions, just like in trisomy, there will have certain uh, uh, there will have some ways to express them. And they are all guiding us to know whether these cases will be helped or not. So that is the basis why we need to go know genetics. And when there is a, there was one twin study as well, and it showed that autism rates in twins is when one twin has autism, the other twin may have the autism is highly probable. So autism is highly heritable. And also when one identical twin has autism, there is about 80% chance. But about siblings, this is also, they say siblings may also have some autistic features or some psychiatric conditions. Uh, when I have treated so many cases, I haven't found that very true. Uh, it can be a probability, but it could be even because of the circumstances in the house. Because parents are always taking care of the uh, sibling who is autistic, right? And the younger one or the other sibling, they will have find difficulty because of lack of care and attention. That could be one reason. But I didn't find much uh, what to say, any uh, problems in their psychiatric conditions or any problems very deep down. So, extremely skilled and detailed phenotyping is important to know the trajectories in autism to answer critical questions. And I will urge you to know the genetic testings done, especially in the cases of severe autism case. And also that will help the parents to have a next sibling, next child, because genetic phenotyping and other things that will help to know whether the next child will also have some problem, whether it is related to the parents' genes or it is only de novo mutation. That is, this child has some mutations uh, during formative time, and that's why that child is autism spectrum, or their parents have some genetic basis. So that will help in genetic counseling, and the parents can have another child, or they should not go for another child. So these are all the uh, mutated genes and other things. It is little more of a thing for researchers. So there are several conditions associated with autism that stem from mutations, single gene, including Fragile X and Rett syndrome. But less than 1% of non-syndromic cases of autism stem from mutations in any single gene. So far, at least, there is no such thing as an autism gene. So I will skip these things. As I already told, it is mutations in the parents or in the child, that is de novo. And then, results show that relative to male, females have greater resistance to autism from genetic cause. So, what is the relevance of getting the genetics background? So, in some cases, they are rectifiable. Like, if it is due to some uh, no enzymes are produced in the body, such things can be rectified, and they can have a normal living. So understanding the genetics will have a long way to go. And here there was a misdiagnosed as cerebral palsy, but it was a treatable dopa responsive dystonia. So, so definitely understanding the genetics helps in our prognosis of our cases, and also we can help them better. And if it is a treatable cause, it will be well and good. So, and also another way of finding out the background, what is going on, that is determine the levels of health of a patient. So a person-centered approach can capture the sum of these developmental process at later ages, offering strong clinical value for prognosis with individualized genotype-phenotype relation. And then, I want to tell about one case. I had treated one girl of 21 around when she came to me. She was still studying, and she had repeated self-harm. She has tried to do, she wanted to do suicide by cutting her veins 3 times, and once with sleeping tablets. And I diagnosed her as borderline personality disorder because she was very dependent on her, one of her classmates and friends. She who used to be seemed to be very kind and very supportive. Okay, till then, and then she was so dependent on her, like each and every day, everything will be taken care by her friend herself. So she says, you get up, she will get up. She says, you study, she will study. That way. She's totally dependent on the girl. And then she reason for self-harm was she wanted to meet one big cricketer wife. Uh, I don't understand what is the logic. She don't want to see the cricketer, but his wife, and she couldn't do that, and that's why she had all very irrational thoughts. She wants to come to. She is not in Chennai. She was studying somewhere else, in another place, and she wants to come to Chennai to see when the cricketer was here. Okay, so she will mid of the time night. She wants to get up and go and see the cricketer's wife. But that didn't happen. It was a very big task for her classmates and roommates to keep her in subdued condition. And she will be easily angered, easily feel bad and all this. And then, but I saw that she had no emotions at all while narrating her all problems, and even while cutting her hand, all other things. See, you will have a item of some problem, or you will have, you will cry or you will do something. No? She had no emotions at all. She was bland. She was talking for 3 hours on a stretch. I couldn't even talk in between and tell her, ask her questions. Okay, all whole 3 hours she alone spoke. And then I was little suspected. What is this? What's going on? And then after that, I treated her. Her remedy was China. She is in reverie, like uh, she is in some another world. China helped her a lot, and also she is pulsatilla type, and she completed her studies. She had lots of arrears, like she could only pass one subject, but she completed her studies. And then uh, one of her friend, uh, male friend, called her to some place and he abused. You understand? There is this circle of abuse, getting abused. She was on psychiatric drugs also before, and also with homeopathy, we helped her. Second time, she had that abuse by a male so-called friend. And it was a big audience. And then she got married in 23, and her husband also abused. And it was a very severe abuse, and she is in the process of divorce. Why I'm telling is she is falling in the same trap of getting abused again and again. But the point is, she calls me, she talks to 1.5 2 hours non-stop. She will tell all the things happened. And then she is not even seeking homeopathy medicine now or any counseling, whatever. So she has only one thing on her list, I think. That is, she needs attention and validity. So for that, she is going through all these things of uh, what to say, self-harm and as well as abuse, isn't it? So now we can understand. It may be that they may not be having a borderline personality disorder, but they may have autism. in girls, it is really difficult to understand. It is differentiate between autism and borderline personality disorder. And this case, I wanted to talk to you about this case. And then, so how we come across, how to know, uh, how we can treat such cases, isn't it? So it's a very good guidance is with levels of health by Vipul. I have studied many of the mm, legendary doctors, all those things, and even Hahnemann and all the things. But my thing is, Vitalcos is the most practical way, especially for our time, because he has given everything needed in treating whether it is or acute cases or in difficult cases. He has given all the guidelines, and I totally rely on levels of health by Vitalcos. And we will talk about this more during next webinar, where we will be talking about um, treatment of the autism spectrum disorder. And then uh, it is very helpful for evaluating the prognosis with levels of health. And then it involves studying the current pathology, influence of the past diseases, past treatment courses, psychological and other circumstantial stresses, hereditary tendencies, or family. So it's a wrapped up one thing wrapped up. Everything is there in levels of health. So uh, these are determinant points. Next time I will talk about them. I am only giving a brief outline about levels of health. So where there is infectious diseases, fever, high or low grade fevers, treatment courses in number of days if hospitalized, prescription drug doses or acute diseases, minor illnesses or disorders, usages CAM medicine, and exposure to chemicals, occupational hazards, and other things, and family history, immune compromised disorders or allergies, congenital disorders or tendencies, genetic disorders like G6PD deficiency, tuberculosis, and organ systems affected, carcinomas with age of its development, endocrinal abnormalities, skin disorders. So here I want to talk about one case. This child has come to me. Now he is in fifth standard, and he has a developmental delay. His speech is not fluent, but he has difficulty in comprehension. He can't sit down, and also he is even though he is in he should have been in fifth standard. He is only at level of first standard. So and he has been diagnosed with learning difficulties, learning disorder, and he has been referred to a psychologist. And now his past history is he had COVID when he was 7 year old. His UKG, which was very difficult. He was very slow learner, very slow milestones as well. And then uh, 2 years he sat at home because of COVID. And his mother was going through some difficulty, like her mother was diagnosed with cancer and she was taking care of her mother. And he didn't put this child into school because he couldn't manage. And he was sitting quietly, just like that. Okay, no schooling for 2 years. And then he was born 3.5 kilos. huh, And his mother was on insulin during that time. And then first child, during first pregnancy, his mother had diabetes, hypertension, and eclampsia. She had uh, pre-eclampsia, a very high B, and then cancer history. So, and he was, so now you can understand the basis of this case, right? So, what is your opinion? How can we help this child? Whether he will be having more of a normal, near normalcy, or what is your opinion? Please let me know in the chat box. So, what is your opinion? And then this slide is previously already we have spoken about these things. It is only for refresh. So I didn't talk about this. This is for just refresh. And then, yeah. So now I want to talk about a new development in focus on an infective origin, PANS and PANDAS. So PANS and PANDAS is pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections. PANDAS is one of the controversial diseases, and it is with rapid onset of obsessive compulsive disorder and or tic disorder symptoms as complications of a group A beta hemolytic streptococcus GAS infection. Precise epidemiological data are still lacking. So, in pandas, pathophysiology is attributable to animal model studies where there is disrupted dopamine release in basal ganglia. So, these things I will share. PANS and PANDAS, these guidelines I will share in the group. So, you please don't take time to read all these things. So, the point is autoimmune infections, okay, where with pediatric OCD and Tourette syndrome, like blinking, tics, and seizures, all these things, they can have one origin. So that is my point. Okay. PANS and PANDAS is also included in that where it is because of infectious origin. And one child, recently, I have been treating one child with dystonia. He has suddenly he developed like when getting up, he will be having a gyratory movement, and he may fall down. And then it is very of a recent origin. And he is a normal child, especially his milestones have been very normal. He only that he had COVID when he was a child. That is, now he is 12-year-old, and he had COVID when he was 7 or 8-year-old now. Then, and it was not very severe. After that, he developed this very recent. And then you can see that there is some infective origin. And then they have done the genetic testing as well. And genetic testing, they say it is of infectious origin, most probably. So this case, what do you think? With homeopathy, it can be cured, or the child may have these episodes. It will move on to some other things. What is your thought? Uh, just now I have started, and he is responding very well to Rasta because he had some symptoms of Rasta. That's why I started with Rasta, and he is having very less episodes compared to previous. Previously, he had 3 to 4 episodes in a day. Now it has come down to 1 episode or no episode per day. So these are PANS and PANDAS is a very important group of neuropsychiatric conditions where we can see very similar to autism spectrum disorder. So that's why I have taken up this, and it is treatable even with allopathic uh, treatment. But then you can understand how good it will be with homeopathy, isn't it? It is a autoimmune condition, especially due to uh, streptococcus infection. And then these things I will share you. So what are the symptoms? OCD, eating restrictions or severely restricted food intake, anxiety, tics, emotional ability under depression, irritability, aggression under severely oppositional behavior, behavior, developmental regression, increase in temper tantrum, loss of age-appropriate language, clingy behavior not related to anxiety, sudden deterioration in school performance due to difficulties with memory, concentration, hyperactivity, impulsivity, new deficits of visuospatial skills. And then I want to share one case where that boy had mumps, that is 2 years back, and he developed hemangioma on the right side. Boy of 9 then. Now he is 11. And then they came for a, they came to me for a infection in his groin, which is very itchy, especially at night when he lies down. And this boy has uh, recently developed. He'll be very restless in his sleep. He will be going round and round, and he'll be playing football. It's not a calm, peaceful, deep sleep. And then he has, when I observed in my clinic, he has no manners. He will be sitting like uh, like king and something like that. And then he has restlessness, fidgety, and he can't sit at a place for more than 2 to 5 minutes. So based on all these things, I started with Rastox, and then I gave him sulfur 6 potency, and his manners also improved. His fidgety also reduced. Now the point is, this is started after mumps infection, right? So it is infectious in origin, and I guess this skin condition is also, it's a due to the infection what he already had. So the point is, we have to see that. See, I'm not suggesting that this boy is autistic or going into ADHD, whatever. The point is, we have to always give importance to the infective origin in autism kids. That's why it will be very important point. Then we can have more cures in our cases. That is the point. And these are all symptoms uh, done by not homeopathy. It is by allopathic doctors. And imagine what we can do with this all this knowledge. This will be very helpful in our cases, right? And that's why I have put up this in here. And these cases can be very severe, like hallucinations and severe psychosis might be part of the symptoms experience. So that means, again, it comes to levels of health, because in levels of health, if it is very high, they will have very severe type of symptoms. But with homeopathic treatment, maybe even single dose, single remedy, or whatever, or with sequential remedies in a right order, we can pull forth cures. And that is a very great thing, isn't it? So we can remove the tag that all ASD cases are incurable or whatever. There is no generalization. And then uh, so these are all diagnostic criteria. I will share these things. And another, I was talking about that girl who is very mild and very, very mild, non-verbal, and very good, and no desires or ourselves, whatever. So that girl, she developed high fever, I told, with phosphorus, and then she started having tics, like she will having blinking or tuck, 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 something like. So she will be doing the whole thing. It will be episodic. And then it was a very new thing for me. Mm, and I started treating her with uh, Cupramet, because she had some symptoms of Cupramet and other remedies also. And she improved to some extent. And then uh, it seemed to be a very good going. Everything was okay. Suddenly, she developed mm, in December 2020. She developed some fever, which was not more than 100. It was even below 100, and she had fever, and then she had status epilepsy. She was whole day. She was in the arch way. You know, it was a very scary thing. And her parents took her to uh, doctors immediately to a neurologist, and she was put on uh, anti-epileptic drugs. But that also didn't bring down the episodes. Okay, so even along with that, even I gave her medicine. Nothing seemed to be helping her much. And then now also I spoke to her. Her mm, eye contact has improved. Her interaction with people whom she likes, like her sister and a few cousins and friends, that has improved. She is managing at the same level where homeopathy had improved her and left her. Okay, that is at the point of phosphorus. After that, she developed the high fever, right? After that, these things happened, tics and also uh, status epilepsy. So now also she is on anti-epileptic drugs. So the point is, I think her level of health is very very low, and then homeopathy could pull through fever, which is of infectious origin, but that couldn't pull her out of her condition. I mean, she was not cured of autism spectrum disorder. Maybe if she continued with homeopathy, I don't know whether it may have improved a bit, but probably she may not have been verbal, or she may not have come out of her problems. That is my inference. What do you think? You please let me. And then these are all the symptoms. So when you find some symptoms like tics, newly developed tics, or blinking of eyes, or febrile seizures after COVID. So you be alert. It can get into some sequence of severe cases. Uh, just like we are talking about fans, pandas, and other things. If the soil is fertile, especially genetic things and all, if it is genetic background is also there, it can get into very severe condition. So OCD and these things I will share you. So now I am not talking much about these things. Uh, and then, so what is the origin of fans and pandas? There is one reticular thalamic nucleus where the sensory signals as a key driver of autism-like behavior. And the and also even so by stimulating this area, it led to hypersensitivity, seizures, social withdrawal. So sorry. This discovery sheds light on the strong link between autism and epilepsy, which may share the same circuit. While still early stage research, these findings highlight a precise new target that could inspire future treatment for autism spectrum disorder. And my point is, as I told you, if there is one newly developed tics or blinking episodes, and another child I spoke about, another child who sorry, did I spoke about that child? Yeah, she had, yeah, I forgot to talk about that case. What is the time? I will make it faster if it is getting late. This case, it's a very interesting case because this child, when she was 5 year old, she was left with her in the care of her grandma. Her grandma is also my patient, and she has some uh, personality disorder, especially mm, she is very suspicious about her husband, and she could go to any length to degrade him and devalue him. And it was a very big case itself. And usually nobody wants to be uh, with her because she is a very difficult. This is important for this case. That's why. And this child was left in care with her grandma. And then she used to tell very horror stories to the 5-year-old child. You understand? Horror stories. And this child was very sensitive, and she was very, very scared. And she don't, and she will go to the, again and again, she will go to her grandma to hear the such stories. It is like, what to say? It is, in a way, it is somewhat like self-harm, isn't it? Uh, Sometimes children will have that type of behavior. And then the child started having episodes of falling down while talking, or suddenly when she gets up in the morning, she will drop, just like that she will drop. And then I was treating her, and she was getting better with homeopathic treatment. I think I treated her with calcarea carb, which is very top remedy for, especially for petit mal seizure. I suspected petit mal seizure and started with calcarea carb. She was doing very good. And then they were having some financial problems, and they shifted to another city, her parents along with. And there it was a very problem for them because it was a joint family, and these people are very less uh, in financial status, and it was hurting them a lot. Her mother was also in a lot of distress, and this child developed a high fever, 103 high fever. But before that, she had blinking episodes. Just like suddenly she will develop blinking for a long time without any problem. And then uh, that blinking episode was treated with Natramur. She got very good results with Natramur 30 and then 6x. I changed it to 6x because it can be repeated many times. And after Natramur 6x, for some time, for some reason, she got very high fever with headache. And then it was diagnosed as dengue. And they took her to a local hospital, and she was given paracetamol and all. After that, she developed a seizure. Okay. That falling down episodes increased a lot. Her grades crashed, and even now she is on anti-epileptic remedy. So this is because at that point of time, it is now that child is around 14. She was 5-year old when I started to treat. So I always thought that if they had not treated that high fever, dengue fever with allopathic drugs, she would have not gotten into seizure episode. I may be right or wrong, I don't know. But this is the trajectory, how things go from one level to another level, one place to another place. Like she had falling down episodes, and then infection, and then suppression of the infection, and then getting into seizure. And then now I want to focus on this. So what are the trajectories in pans and pandas? Relapsing and remitting and retenting the same way. Relapsing and remitting, worsening baseline across time. So I think that girls comes in this one. Primary persistence and no return to baseline. That is that girl. Which one? I just now I spoke about phosphorus type. And then secondary persistent multiple episodes with increasing baseline until it reaches a chronic episode. Sorry, not this one. This which that girl of non-verbal and phosphorus treated girl. So she comes to this level. isn't it? So you can understand the uh, yeah, these are relapsing and remitting with worsening baseline, primary persistent, secondary persistent. You understand this strategy. So these are all helping in your clinics to understand whether you are helping your child, helping the child, or if you are making it worse. And that another girl I told, no, the blinking episodes and dengue case, I actually referred her to one of my senior mentor, and she is with him even now, and he has been maintaining her at the same level. She didn't get worse. She has falling down episodes. Her comprehension is okay, good. She is in normal school. Everything is fine, but still she is in on the anti-epileptic drugs, and also she is continuing homeopathy. So I thought I can cure her. That didn't happen. I thought he will cure her. That also didn't happen. So I understand her level of health is not as high. So we can't say everything can be cured with homeopathy, even though they are symptomatic, even though they are getting fever, isn't it? Yeah, mild and initial stage completely curable. Deep miasmatic with layers of miasm is tougher to treat, isn't it? These are autoimmune conditions. Fans, pandas are autoimmune conditions. And then continuum theory. So this is Vithalko's another theory where health and disease exist on a continuum where chronic diseases result from a suppressed low-grade inflammatory response, and the body's ability to mount a strong high fever, acute inflammatory response is lost. So this is continuum theory of health in homeopathy. Uh, yeah, under this theory, the rare appearance of simple acute diseases with high fever during homeopathic treatment for chronic conditions is a positive sign, indicating a return to a more efficient immune response and a favorable prognosis. So, this theory seeks to link the modern immunological understanding of the microbiome and immune system with homeopathic clinical observations. It's a very interesting paper. Please go and read this in whole. The continuum theory and the levels of health theory were separately proposed to explain the myriad responses to treatment and understand the process of health and disease in an individual. In light of accumulating evidence on the intricate relationship between the immune system and microbiome, an attempt is made. This is another one with a microbiome, okay? And the article to connect these two to explain the transmutation of the efficiently responding immune system through inflammatory response and high fever. So one involved in a low-grade chronic inflammatory process resulting in chronic disease. And there is already enough evidence to demonstrate the role of microbiome in all chronic inflammatory diseases. In this article, we will discuss the mechanism by which subjecting a healthy person to continuous drug treatment for acute inflammatory conditions at a certain time leads to transmutation to chronic disease. Although this hypothesis requires further experimental evidence, it calls for a reconsideration of the manner in which we treat acute infectious diseases in the population. So uh, now I will complete my here itself. Other things we will talk next week. So my point, uh, please understand what I'm making the point here. When we are treating any autism condition, autism cases, we have to understand the outline of the case, what level it is of the health of the child, what is the genetic background, uh, and If I am telling all the cases, it does not mean that I am telling all these cases, other things, learning disorder or the mumps case. I'm not suggesting that they all will get into autism or ADHD or seizures or whatever. The point is, it's a continuum. Okay, continuum. So they start from one place and they continue to get worse or better with uh, treatments. It could be homeopathy or otherwise. So the point is, when we are treating, we should be understanding where we stand. So after starting the treatment, where we stand now, whether we are helping the child or making it things worse. And as I told with the child, mm, she had actually COVID also. First time she had high fever after phosphorus, and second time in December 2020, as I told, she had COVID. Her reaction to COVID was status epilepticus without fever. She couldn't raise her body temperature to fight the virus. So that's why she is still in the seizure mode, and her other things have not improved from the point where we left her, like homeopathy left her. So this means that continuum is there, but it has been arrested because of good response to homeopathic treatment. Yet the her level of health is not that good, so she is not improving further. This is my analysis. If it is not correct, you please tell me, I will rectify. This is my analysis. And now, if you can understand these dynamics, these trajectories will be very helpful when you are treating autism cases. And then uh, we can not be telling that I did this and that in autism, isn't it? So we can't be giving tall claims or baseless allegations that cure autism. Those things will not be there because it's not a small single thing, huge symptoms which has to be removed. We have to be very, very cautious and very, very focused of what we are doing, where we are heading. And in the process, we will be helping them to get rid of their seizures. Actually, in epilepsy cases, I have seen it's a very good response whatsoever. And our health or disease, everything is in continuum. So that we have to keep in our mind. And then we will understand that whether we are helping or we are suppressing the case or what. We are not helping. Then we have to send them to the most appropriate senior homeopath or most appropriate other doctor who can help. So there should be no egos in that. So neurological and development, these things, Aditya already had shared this. So it's a diverse thing when it comes to ASD. These things we'll talk about in next week. These are all the scales by which we'll diagnose cases. And I want to share two cases, two adult ASD cases. Mm, it may interest you. One case, uh, that boy had, I had shared this case previously in another webinar. People who already have heard it, please excuse me. That boy had some bad experience when he was studying engineering. That is way back in uh, 6 years back, 6 to 8 years back. And then it was a very bad thing. And his friends and two of the friends, they were going to do suicide, and they were prevented. But the way they were treated after that, it shattered him. He was very, he felt very bad, and he stopped his studies and came back to his house. And from then onwards, after the lockdown, he was he will be sleeping whole day. or he will be playing games on video games. Only two things he will do. Okay. About there are no specific desires or ourselves. He likes to eat all the things. He's a very calm and mild personality type, and he is very helping us. If his father asks him to help, he will go and help that way. But that's the only thing. So you are asked, his father asked him to help to lift a box. He will go and lift that box, and he will come back to the original state of lying down or playing his thing. And then spoke to him. He was very happy to talk to me. He told, "Oh, finally, I have got some help and all those things and all." But the process was not interesting for him because he has to get out of the bed. He is not getting sleep now, and he is not interested in getting better. And then I came to know that he has been diagnosed as adult ASD, adult autism, and ADHD. And then he received Falcon paragraph initially, and his response was so good. Everyone was very happy, including his mother. But that didn't sustain it. And then I gave him uh, cobalt because he needs support for everything. After that cobaltum for almost 3 weeks, he was far better from his previous day. But he had before cobaltum, he had very severe episode of depression and anxiety. So he don't want to come out of his problem. It was a very safe place for him. He has something like this world is not good enough. I don't want to leave. But he does not try to do suicide or whatever. But he has lost interest in living. That is what he says. And he says, you haven't touched that core feeling of not want to live anymore. And that felt bad for me. But what his mother says is, he's a far better person than before. Uh, I couldn't make out between like his mother is telling the whole truth or he is telling the whole, so he is telling the truth. And I think he is telling the truth to some extent, but the thing is, he don't want to come out of his that cocoon also is true. And then I started sulfur calcarea lipotrio, one after another, 3 days, 3 days, 3 days. And it helped him a lot, so much so that he went to a abroad trip to his sister's place. He was there with her. He took care of her dog, and he was helping her and all the things. He was he went to abroad alone. Okay, so he went through all the things processes for going to abroad. Okay, after 6 years of sleeping, he could pull off that. That means he is totally capable, right? Just don't want to come out of his problem. And then uh, now he told, I don't want your help. You are wasting my time and money. Uh, I don't want to continue the trip. So after that, his mother told he is in a very good spirit. He is not sleeping. He is doing all his routines and he is doing something else also. Like he wants to get into uh, something out of his house. So that was very heartening for me. And let me see whether he will be interested in homeopathy again. But I helped him along with homeopathy. At 2 points of time, I was very scared. Like he will harm himself. He may go for suicide. So at that point of time, first time I told them to send him for yoga therapy, also for flower therapy, flower remedies. So, and his mother told the yoga therapy was good, but the flower remedies didn't help him much. At least he told me like that. So now adult ASD cases, I think they are very late onset. He started it with when he was 21, 22. Now he is 27. Uh, you can understand the pattern, right? So I think adult ASD cases, they will be very suitable for constitutional remedy rather than they need other things. Maybe he needs rehabilitation. Uh, but still, it's a very good thing to have good results with adult ASD. Another case also is there. I think it's getting late. Shall I continue? Shall I tell the another case, adult ASD case, or shall I stop, doctor?
You can continue, ma'am.
Yeah, I will not take much. This another adult case. This boy, he had been, he got his own seat in, it's like IIT, like college, government college. He went to Bhubaneswar to study there. He was all alone, went there. He studied there for 3 years, and he went to Kolkata to study PG. There he was abused by his roommate. But this boy was having uh, indications of autism since his childhood. He was treated by me previously, and there was gap of almost 8 to 10 years in between because he was okay. He was carrying on his normal day-to-day thing. He is very good in studies, and he's a maths genius. So afterwards, I didn't get a chance to teach him. And then he went to Bhubaneswar. He got his own seat and went to Bhubaneswar and studied very well. And then to Kolkata. And then there he was abused by his roommate just because he studies very well. You understand? And he didn't have even the that inclination that he can change the room. He was he is putting up with that boy for 3 years, and he lost his sleep, he lost his health, he lost his self confidence. He thought, I should not live anymore. I don't want to live anymore. He got into all bad habits in the sense like getting up late, not studying properly. He somehow barely he could finish his PG. And when he came back, he was in a very bad. And his mother was very worried, and she started with homeopathy only. He was initially he was taken to Nimhan for counseling, and also he was given other therapies also, but they were not very effective. He was very angry, that sudden anger outburst, and he will eat like anything, or he won't eat anything for a long time in that way. So we see all these patterns before, no, whatever I shared before, and this boy received rust of initially because he can't sit even for a 1 second, 1 second in one place. Rust of helped a little bit, and then I switched over to Cobaltum because he also needed that strong support, but Cobaltum didn't help him. And then I started with sulfur calcarea like 5, and it helped him so much that now recently he came to me for the first time. He spoke very well, and he told, I never imagined I am doing all these things. I don't even thought of changing the room. I was so naive. It is not my character at all. I didn't study well. I have left all my opportunities. See, the insight, he got the insight after his treatment with home. And don't you think it's a very good thing that homeopathy can almost cure the case? As I told, he was having all the indications of autism previously, and adult also when there was a very strong cause like abuse. And that made him to get into the autism science again, adult on. And then now he is all right. He's so bright, so such a vibrant now. And it's very heartening to see the boy. But I had one failure as well. Failure, I don't know. So it can be termed as failure. But that boy didn't want to come out of his that house. Okay, that cocoon. He has sneezing, anxiety, like wheezing, like breathless. These are the only three symptoms. And he will have sneezing, 30 to 40 sneezing per day. I treated him much and uh, he stopped and he was also violent with his parents. He has a family history of uncle being in such a state who didn't go to any job or he left all his jobs, good jobs and all. That didn't work out. Maybe the other circumstantial help didn't occur. His parents are not very keen on getting him out of that cocoon. They didn't work on him. Yeah, with this case witness, I want to complete my uh, today's webinar. Thank you for hearing me patiently. Thank you so much for this opportunity. Hope I have given some insights, some clues, which will be very helpful in your clinical practice, also in knowing your cases, also in helping your little friends. Yeah, thank you so much.
Ma'am, there are two queries.
Yes.
Which was the one was which was the potencies used?
Yeah. 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 Not also.
Yeah, you're audible, ma'am.
Yeah. That was previous.
Which potencies were used?
Huh. Yeah. Potencies usually I use. Yeah. This next week I'll be talking a little bit detail. Usually I start with 6 potencies, depending on the case. So when I told about the PDD NOS case, I even used Calcarea First NM and Carcinosinum 30. Okay. So 10M also I will use. And these cases, because of their reactivity and their, what to say, susceptibility, based on that, I will usually start with sixth potency in very reactive cases. So first time I will start with sixth potency and then I will understand what medicine, what potency is suitable. So that that adult ASD case, Falcon Pyroglycis was in 1M and it gave very good results. But afterwards, it didn't sustain. So I shifted to Cobaltum 60 because I don't want to aggravate him. Because first time it was very good. Second time when I repeated, it was giving very strong aggravation. So that's why I shifted to 6 potency. And this boy, another boy I told no, maths genius. Uh, I used all 6 potency only. I used Calcarea First 10M once, but it gave very severe aggravation. So I stopped that. And then I shifted to sulfur calcarea like for that trio. And then that previous girls, those 2, 3 girls I told, no, those cases also I used 60 potential. Just phosphorus was 200. After that only that girl started having high fever. So, uh, that made me nervous actually. And she had a very strong craving for apple during her status epilepticus. That girl, whatever I shared of the case, that COVID, this thing. And then I gave her anti-inflammatory, but it didn't help. So that means she is not in a level to matching with the potency. Maybe I should have gone for 0 bar potency. I had no thought about that at that point of time. Maybe you can think of when the situation is very bad, we go for 0/1 potency. And also, I told about one severe case of autism. That case, he had very violent, and he wanted everyone to come and beat me. He will ask everyone, please come and beat me. A 16-year-old boy. He was non-verbal and very severe autism case. And I gave him belladonna 6C. It aggravated so much, they stopped coming to me. So maybe I should have gone for 0/1 potency. I'm not sure because I couldn't treat them further. So, uh, so you choose the potencies based on the cases, uh, but better start with 6C. That is my thought.
Ma'am, there is
Yeah.
another question. Do you
Hmm.
have experience using batch flower remedies in any of your ASD cases as an acute?
No, I don't use much of backflower remedies. I'm not very well versed with them. I send the patient to another practitioner who does exclusively only backflower remedies. I have not much experience with backflower. I use only pure homeopathy.
There is another question. Trio of
Yeah.
remedies for adult autism in what potencies, ma'am?
Yeah, that is also 6 potency. 6 sulfur 6, calcarea 6, and like it has been excellent. Excellent. Uh, I can't say much, but I will recommend it. Try trios of Nash wherever it is applicable. It's wonderful.
Thank you, ma'am. I think
Yeah.
that is the end of questions.
Yeah, and I think next time we treated cases. Next time I will talk about that, ma'am. Padmaja Rao, ma'am. Thank you for joining in, ma'am. Next time I'll talk about treated cases with remedies. And dengue attack, yeah, I explained about that, right? She is still on a anti-epileptic drug as well as homeopathy. And I think no more.
I think there is no other questions.
No other. Yeah.
So we can wind up the session.
Yes. Thank you so much.
I sincerely thank our faculty, Dr. Rekha Karnam Srinivasan, for the valuable session today. Your insights were truly helpful. A special thanks to the organizers and support team who worked behind the scenes to make this session smooth and successful. I also thank all the participants for your active involvement, which made the class engaging. The third and final session in the topic, Role of Homeopath in Autism Spectrum Disorders, will be on 23rd September. Looking forward to more such sessions together. Thank you and good night.